My journey is basically at school. I was quite interested in medicine and biology, and taking biology for my A-levels, I just knew I loved the human body. That was when, yes, this is for me.
I love the comparison to trying to drink from a fire hydrant with a straw, except I add there's multiple fire hydrants coming on at any one stage and you're jumping between the fire hydrants. And it was, my mind had felt quite brainless when I started, and towards the end you go, holy hell, the brain starts to absorb and you absorb all this information. It's just incredible how the mind can expand.
Oh, coming home, right? Coming home, I grew up here, finished my high school here. I finished my medical training in China, but then I did come here to work. And after my public health training in the States, I came back here. That's when I worked for WHO and also AusAid. That's just like a USAID version of the Australian government. So this is really home. And all of my family is all here. I'm the only one in the States, and my friends.
Then, as I did my own research into everything, VCMP just felt like the right fit, because the main reason why I wanted to do health was to help, to help, because then, I was seeing things like how my own grandmother couldn't get certain healthcare because she'd be sent from pillar to post, where she could have just got the same thing from one person. So I just felt like I want to be involved in that. I want to, make some kind of difference.
I had a woman with chest pain this morning. I referred her to hospital. And I had a young diabetic patient with appendicitis, which comes just, my assistant calls me and said, you have to do a visit at home. So then I'm off, and you find somebody who's young and who's very ill and had a lot of pain. And then it gives you a good feeling that you can, arrange things very quickly. And so within about 20 minutes you have the ambulance, and person is now in hospital. And later at night or tomorrow morning I will see his results and what's been done. That is what's in your mind all day, of course, these patients. Yeah.
By you telling them that you that is talking to them is also a survivor, you was in the same state, they are incorrectly, and they walk out from the ETU and they are back, psychologically is a kind of huge, positive impact, all right? They feel that, they can also be like you. And so our roles in there was actually to encourage, patients that you can make it, you need to be strong, you need to have the faith that you can make it.
You need to be passionate about your work. People are passionate about so many things. It may not necessarily be the job. The job may be a means of earning a living. They may be passionate about something which they do as a hobby. But to me, it so happened that my passion and my means of earning a living is the same. So I totally enjoy what I'm doing. But yes, you need to have that kind of a drive, that motivation, that interest into the job to excel and go raise the bars, go beyond what is expected out of you, and to gain that kind of satisfaction.
Enjoy my work. That's why I'm still in it, and at my age that I still go to work every day and enjoy it is because I feel like it's worthwhile, and I like to listen to people's problems and try to give them some direction so that they do have a healthy, long life, and it pays off. There's always those times when people come back and appreciate what you did for them, or sometimes you don't even know what you did for people and they come back and say, you remember, and you don't even remember telling them that or giving them that advice, and they come back later and thank you for that.
But it's like a routine. You come to work, you do what you need to do, and you get thank you from this, you get thank you from that, from this one or that one, doesn't matter. and you continue your day. At the end of the day, it's work. You're trying to do it as good as you can, as professionally as you can. And you're studying. You keep studying all the time. After you finish the work here, you go home and you read and you learn. And I don't think it ever ends.
The physician assistant, the American model of the mid-level healthcare provider, is now over 50 years old. It started with the retraining of military medical corpsmen of the Vietnam War era. Graduating in 1978, Dick Helber is of this first generation.
She'll increase her insulin to 20 units, period. She has an appointment with diabetic education.
I enjoy the adult medicine. It's a lot of work because there's a lot of things you got to deal with in every visit. So it's not like a wild child check where you just bounce through it and give them their immunizations and they're out the door. But here you got multiple things going on. Usually you got high blood pressure, you got diabetes, you got cholesterol, you got maybe a previous cancer, or you're working up some illness of anemia or something, and so there's always something going on, and a multitude of past medical history and ongoing problems that you gotta all work with. So I come about 6 o'clock in the morning. I start my chart work, reviewing my lab results, any patient calls from the day before that I didn't address, renewing medications, and then I look at my schedule for the day, and so then I start seeing my patients at 8 o'clock in the morning.
So what are the differences you've noticed between a physician's assistant taking care of you and a doctor or an MD taking care of you?
It's easier to get to a specialist.
That's what I was going to say.
It's more like you're dealing with someone at your own. You can understand what they're saying.
They're comfortable around. They seem more happier, and they talk with us.
He doesn't hand out. I used to go to the emergency room when I needed to see a doctor, because I was on the road. I was on a truck. I ran cross country, and you'd go into a doctor, and the first thing the doctor would say at the emergency room is, "What kind of pain pill do you want?" Mm-hmm. You'll never get me to say a bad word about a PA.
Nope.
It ain't gonna happen.
They will save your life.
What are the benefits of working with PAs?
Well, the benefits in this town is that there's more people that get to be seen by someone who has medical training, which we have a desperate need of. There's not enough physicians around here, and we have very well-trained PAs and nurse practitioners that help accomplish what we need to do with people here. So that's the benefit. Many practices hire PAs because it has a real good financial benefit. I mean, you tend to make money off of them, but that's not the arrangement here where I work. It's at best neutral because there is supervision involved and things like that. And there are a few procedures that I do that he doesn't do that might come here.
Yeah, I'm not a real procedure person.
Until I train him to do those, and he doesn't.
I don't like that. I'm lazy.
He's cognitive.
That's right, I'm cognitive.
And then usually get an hour and a half to do that, to catch up at noon, and then I'm back seeing patients till 5 o'clock, and then finish up my day with my dictation and stuff. And usually I'm done by about 6 o'clock, so it's a 12-hour day. Yeah, we have a lot of fun. I'm always noted at the clinic as the one with the laugh, and patients will say, when my offices are next door to each other, so there's just a wall separating my two offices where exam rooms, and so I'll be in one exam room, and then I'll go into the other exam room, and just like last week, the one lady says, Dick, I sure like listening to your laugh when I'm sitting here, so they can hear me, you know. But
It's therapeutic.
it is good. Yeah, I think it is really there. Well, they find laughter makes you live longer.
And what are those?
These are eggs. One of our people at work here has chickens and ducks, and so I buy some from her every so often.
Can I see them?
Sure.
These are
Duck eggs.
So what are you going to use them for?
Probably use them for baking, mostly baking. Yeah.
In the Netherlands, physician assistants have existed for over a decade. One of the first graduates, Quinten, is a general practitioner, educator, and advocate.
I want to introduce you to Merel. Merel, she is a student, and I'm her preceptor. She's doing a rotation here, and she's following the Bachelor Medical Assistant. So in the Netherlands we have a PA program, and you can get into the program if you have a bachelor in nursing or a bachelor in physiotherapy or a bachelor like you do, the Bachelor Medical Assistant. Yeah. But you don't know about that, that's the future.
Not yet, yeah.
Okay. Even met deze uitslag hoor, en als je wil kun je met
What kind of patients do you normally have then? Mostly elderly or?
I see all patients, so young babies to very old people. I visit people that are very ill at home. I help people when they are nearly going to die, and to give palliation therapy. So in this practice there's actually not a big difference between the patient that I see or the physician sees. This is like our standard room for a physician. We have a department for investigations and for little surgical techniques over here. What I was talking about is that we have a relatively large building for an average general practitioner practice, and that's because we want to combine more functions together and work together with other healthcare workers.
Here, when you look at people, they take pretty good care of themselves here.
Yeah, it seems. behind those curtains. Now, if you compare it to other countries like the US, people are less obese. They smoke less, they drink less, but it is increasing also here. So we're getting more and more diabetics problems. Maybe we are a very prosperous country. Our economy is rising. Reasonably, not too much very poor people, although that is also increasing. And healthcare is available for everybody. So yes, we are doing quite well, but our problems are increasing.
Are you really busy here? Or?
We are really busy, yeah.
Because of aged people or new people moving here?
Aging and new people and new people moving in. We have relatively more refugees coming over here, and but it's mainly because we think that a part of the care that is given in a hospital can be done more efficient when it's done in primary care and cheaper.
Wanneer zij die brief krijgen, begint na te denken. Dus wel bewust donor's kunnen zijn dat de vraag voorgelegd wordt aan de familie.
Not all Dutch have big noses.
So why did you get knighted?
Do we really have to talk about that? Somebody thought that would be a good idea. Now what happened that I, with a small group of students, we found that there was no legislation, there was not a professional organization, there was not a professional profile. profile. We had nothing when we started as students. So when you're among the first people, you have to start walking. And then you get enthusiastic and you like this, being an ambassador and being a pioneer. And so then you can't step back, you have to go on. And then you are really going for legislation, and you are really going for a recognition of the profession. Well, then it takes some spare time. Yeah, it takes some. So that's what you do.
While recently introduced from the United States, PAs in the United Kingdom are called physician associates. Jess is a graduate student at a program in London.
So I actually, in my final year of university, there was a teacher that was teaching hematology. And he mentioned in like one sentence in one of the lectures that he was a physician associate. And I was like, okay, what is that? Sleepy, confused, so I need to look sleepy. Confused, dry hair, hair loss, loss of outer third eyebrow, dry palms. Okay, so we'll do that? Yeah. Cool. Sounds good. It's been a while now. I've just been feeling kind of low and just I don't understand what's happening to my body. I'm just not feeling well.
Mm-hmm. Okay. So how long has this been going on for?
I'd say
So we have a PBL, which is problem-based learning, once a week. So we get given a new case. So we spend about 2 hours discussing a clinical scenario, so a pretend patient. And then we have learning objectives that we go away and work on over the week.
Yeah.
So that's really helpful. I find that's like the best way to learn.
I agree, and coming back and discussing the learning objectives, and some people find something so interesting that you've missed, and it really aids your learning, talking through it all, doesn't it?
Yeah, because we all get different information, so it's so good having those few hours where we're discussing
and also that because some people actually have experiences, so they've seen, let's say if they've done nursing in the past and they've seen a patient like that, and when they tell stories, it retains mind a bit more, doesn't it?
Yeah. My work experience is actually mainly in Brazil.
Can you talk about Brazil?
Yeah, it's very, very different. It's a lot more relaxed there. I was so surprised at how easily I got work experience. I just met a nurse and I told her, I would love to get some experience in the hospital. And she was like, okay, I'll call a doctor. She called a doctor and was like, I have a friend that wants to, go to the hospital. And he was like, yeah, just tell her to come in. So I went in to his office, I met him. He's a cardiologist. And he was like, yeah, I'm in on Thursdays and Fridays at this hospital. You can just come meet me and I'll show you around. And I had the most amazing time. I turned up every week for about 10 weeks. And he showed me everything. He introduced me to all the doctors in every kind of speciality. So I went through, nephrology, I did cardiology, acute medicine, surgery. But it's crazy because I just turned up and they let me see everything.
So I have to ask you this. Have you ever made yourself sick, Jessica?
No, I haven't.
Okay. That's great. And so you say you've gained a few pounds as well, is that right?
Yeah.
Okay. And this has this life event ever occurred before? Symptoms?
No.
Okay.
So this is a trick. Hypothyroidism?
Yeah.
Is that hypothyroidism?
Yeah.
Oh, okay, cool.
Hey.
Awesome.
I absolutely love the feeling when you get a diagnosis right.
Oh, yes.
It's like, yes, something's actually going on.
Yeah. When you can answer like the questions that your supervisor asks. I know that.
And they're like, well done. Yeah, once they say well done, it's like, you feel so elated.
It feels so good. But healthcare is very, very different in Brazil to how it is here. It's a lot, obviously they don't have the NHS, so it's a big struggle. Like you see a big separation with the rich and the poor. Which you don't see here. Over here you go into, a hospital, a ward, and you can't tell you know, what status somebody has. Over there, it's quite clear with what status they have.
How do you know?
Just depending. I'd say sometimes a lot of the doctors will treat patients differently because it is a lot about money over there as well. You'll see in their like what wards they're put in, or you know, whether they have a private room. A lot of the rooms are very kind of cramped together. It could be that it's the hospital that I was in as well, but yeah, you do see a big difference there. So that is something, coming here and having experience here, I've got a big admiration for UK healthcare system.
I arrive in Israel as the first class of physician assistants take their written exam. All are former paramedics who will work in emergency medicine.
I used to volunteer in MADA, which is a emergency ambulance. And a friend of mine told me, let's go and volunteer. So I said, okay, why not? So we did this 1-year course where you become an ambulance driver. And we started our training, and we both went on this call, and she saw a little blood and she lost conscience, she fainted. And she stopped her volunteer and I stayed. Then I started working in that company and became a paramedic and an instructor.
You just slowly worked your way up.
Yeah.
For paramedics here in Israel, for many years, there was like a glass ceiling above their head. And somebody who did the paramedic training and spent 3 years in a university and, you know, practiced paramedicine for a few years, if they wanted to change a career, it was very difficult for them. Some went to nursing, some went to other professions, not even medicine. But this physician assistant program is now giving them another opportunity to continue in the same profession, in the same way they did for so many years and they spent so much time. Gives them the opportunity now to grow further and to pursue something more challenging.
How do you think you did?
He passed, and he passed, of course. He passed away. I have to think if he passed or not. I don't know.
We wait for the results.
Yeah, the results are going to be in a few days. And after that, we have a practical test as well.
You seem to have a wide range of experience. You must have a lot of experience in maybe...
We all been paramedics for a few years, yeah, about 15 years.
Yeah.
15 years and more. Yeah.
We have experience in the clinic side.
So that helps you out quite a bit. Yeah.
Very much.
Yeah. Okay.
But not in the academic part.
There was a 60-year-old patient who came here with stroke signs, came with an ambulance, and I started managing him. I asked the secretary to hold the CT. I talked to the neurologist. I didn't wait for someone to take him. I took him myself after doing the examination. And we went straight to CT, and I met the neurologist at the CT. And after doing the CT, we decided to take him straight to the stroke unit and give him treatment. So in the evening, I got a nice call from the hospital, which said that there's no neurologic deficit.
So you felt you helped him out?
Yeah.
Does that feel different than from when you, let's say, worked in an ambulance setting? Or?
Here it's different. Most of the patients are stable. On the ambulance, a lot of the patients are unstable. So it's more intense.
Do you like them less intense better? Or?
No, I do them both.
Yeah.
In my free time, I volunteer in the ambulance. We open an ALS ambulance. We do
both.
We do both.
Yeah. You must be very busy then.
No. It's my free time. I enjoy doing it.
Okay.
It's like I think it's a bug. You get it, then you can't dispose it.
In sub-Saharan Africa, there has long been more mid-level providers than doctors. Liberia has relied on physician assistants for most care since 1965. However, civil war and a recent Ebola epidemic have taken their toll. Elvin and Corlia are two survivors.
I got infected from a colleague of mine, a nurse. I can remember it was on a Friday night. I was on duty, and I met her in the ER, and I was like always going closer to her, doing her assessment, and I didn't know that I was playing with danger. And so after a few days, this lady died, and she was tested positive, of the Ebola virus disease.
One specific patient I interacted with, he was very ill, and I helped establish RV, and he died of the disease. So it was kind of alarming and frightening for us, for those who provided care for him.
About 10 days, I started experiencing, those constitutional signs: fever, joint pain, abdominal pain. The temperature continued to go up to 40, 41. I called my supervisor and said, I think I need to go to the ETU. And he said to me, you need to take some malaria pills and you'll be okay.
So I did the malaria rapid diagnostic test, and it was positive for malaria. So I started experiencing weakness 2 days after taking the malaria medicine, and the headache was still consistent. So I wanted to go to one of the Ebola treatment units to get tested. But each time I would bring the idea, I would suggest the idea to my parents. They would flinch it away because the issue of Ebola at the time, the stigma was so very high.
And nobody, for the fact that community members know that you are in the ET, in fact, your family is totally been isolated. No one wants to speak to your family, and they call your family names, and you yourself being in the community, they call you by names. Oh, that Ebola boy, Ebola man, Ebola woman, Ebola girl. More besides, getting Ebola wasn't by, just a choice, okay? 99.9% of people who came down with Ebola were people that were providing care. They were helping someone.
There were fewer ambulances in the country at that time responding to the Ebola outbreak. So normally if you call for the ambulance, it's going to take like several days or even maybe a week. What I decided to do, I wore a long sleeve shirt. I looked for a glove, and I called up as much as possible so as not to infect anyone while in the process of going to seek care at the Ebola treatment unit. I chatted or texted, and when I was sitting in the front seat, my fiancée was at the back and the driver. I was sick, honestly, because I've been having like almost 2 days diarrhea at home. So when I went to the ELA hospital, the ETU rather, I met the guys there and I got down. I displayed to them my lessons as a PA. They couldn't accept me. Yeah, I was downhearted, but what could I do? So on the 4th day again, it was November 10th, I chartered another taxi, and I went back to the same ETU. I underwent treatment for like 2 weeks, and I came so very near close to death.
For me, I was like admitted on the 28th of June at the JFK, at the old chloride unit. We had a chloride unit here, and I was actually released from that area on the 16th of July, 2014. And after my own release, we have been engaged in a lot of our activities. We also took the responsibility to go back and serve our people, looking at people dying. But we believe that we are some way immune to the virus, so we'll be less at risk to take care of those who are infected. And so a lot of us, including him, a lot of survivors, PAs, went back and started to provide clinical care, psychosocial, health education, awareness, stigma and discrimination, and so on.
Guided by a Wits University teacher, I visit Soweto and a new clinic staffed entirely by his former students, clinical associates, or ClinAs, the U.S. model of the PA in South Africa since 2007.
This is a private clinic set up in Soweto, and it's run by clinical associates who provide health care to the citizens of the area. Tell us more about it.
Okay, this clinic, it was opened in the 1st of March this year, 2017.
Okay.
And basically, it's just to give quality health care to the citizens, yes.
Because, otherwise people have the government healthcare system to go to, which offers basic services at a very low price, but often resources are difficult, or staff is not always there, or there's long queues, or people have to have money to get health insurance or medical aid schemes to go to the private, which often is difficult. So this fills this need in the middle. And tell us how the clinical associates work. What do they do here?
Clinical associates mainly here see patients. Okay. They will be taking history, assessing patients, also doing clinical exam, and then if needs be refer, we have good relationship with surrounding hospitals that always talk to them in terms of when we try to refer patients. So we have a good relationship with the surrounding hospitals that we have.
So the doctors at the hospital say, I know you as a clinical associate, you're seeing a patient, Quality Health, we're glad to take this patient and continue care.
Yes.
And then I also see you have a pharmacy here?
Yes, this is the pharmacy area. Normally what happens is the patient will come through, and then when they come through, the maintainer will help them, guide them to the receptionist. After they register with it, they go straight to our vital nurses. After vital nurses, they go to the bill area.
Okay.
After going to the bill area, then they will go further to the clinical site. Yes.
Great. And tell me, how many patients are you seeing a month?
A month, roughly, we see about 1,000 plus patients.
All right, let's go see some of the clinical associates. You're good if you win. No, because remember, he can edit this.
I graduated in 2013, so I've been working since 2014, actually. Started out in a government hospital, which is very different to this setting. Very, very different.
How so?
Yeah. In terms of the biggest one that stands out, workload. Biggest difference there. In government, it's a little harder because they don't really know us, they don't know what we're doing, so it's always that thing of you need to first explain what we're doing, and then there's all sorts of misunderstandings and people feeling threatened mainly. Well, that's what I experienced, threatened about our profession.
So what do you see mostly here usually?
Different things. Most recently we've been seeing, which is actually upsetting, we've been seeing what we call, I don't know if you know about organophosphate poisonings, children that eat rat poison, like by accident and all that stuff. Yeah, and unfortunately a few of them have died, but then that's what we've been seeing, and I don't understand why, but it's just on the rise out of nowhere. But otherwise we see a whole host of things.
Is there something unique about CAs? You have to be passionate or curious to really do well?
I would say you would have, I personally think that you have to have some kind of passion for this. Because it's so new, number one, and because of it being rural based, you trying to bring a difference, trying to bring a change. So you have to have that passion that you want to change something, that you want to help people. So at least some passion in that aspect somehow. Yeah, I think you'd need that. Yeah, most definitely.
And you take all age groups. I mean, young ladies up to the elderly.
Yes, but most of our clients are between the ages of 26 and 35.
26 and 35, okay.
And we see a lot of pregnant clients as well.
I'm really impressed.
Thank you.
I mean, I educated this guy, and now look what he's done. So if a little bit of me is rubbed off, and look, he's like, woo, blossomed into this tree, this solid tree.
Every physician assistant graduated in India over the past 15 years has worked in the private sector. And while there are now a variety of PA specialties, the first and most storied are in cardiology.
Basically, I was interested in taking up surgery. That was my ambition. But due to some unfortunate incidents, I had to take a diversified field. And now I'm working for the past 9 years into the cadaver transplant program of Tamil Nadu.
Just explain what happened.
In the year 2004, I was just traveling in an auto. A lorry came and hit my hand. I was holding the sidebar, and it was a major crush injury to my right hand. They could not salvage my hand, so 4 of my fingers were chopped off, and the day-to-day activities became very difficult. But still, God gave me strength and stamina to do all my activities in my left hand, except for my surgical skills, which I lost.
Was that a disappointment that you couldn't do surgery?
Yeah, definitely it was a disappointment, sir. But life doesn't end there. There are a lot of avenues as a PA. Clinical research organizations also recruit them. So this accident should not be a limitation. It's only our mindset.
It's a department of cardiology. In that, specialist is electrophysiology. So pre-screening will be done by me, history taking, physical examination, and then sent to the doctor. He will write some investigations. I'll see that those investigations done, and I'll collect the investigation reports and report to the consultant physician. And if he advises any medications, I'll explain them. And also if he advises for any procedures or surgeries, I schedule those things, and I've also explained what type of procedure, what are the complication risk involved in it, and how is the follow-up going to it, and I also schedule the follow-up. Coming down, they're forming a short circuit and it fast, rapidly beats. This is what it is causing palpitation. During that time, the heart pumps like this. In a minute, about 70 to 72 beats per minute. But for her, in 1 minute, it's beating almost 120. It's just 30. Okay. What we'll do on EP study and RF ablation is a medical procedure. A small catheter like this, they put it one from the neck and one from the leg. Don't worry, it will be done under local anesthesia. First they'll give local anesthesia.
This is what my boss tells me. So if you can harvest conduits for bypass surgery, why can't you harvest a donor heart for a transplant? So we are one of the most busiest transplant units in the country. And we do kind of around 70, 75 transplants every year. There's something called the superior vena cava and the inferior vena cava. So we have to have as much length of both of it as possible. There's always a tussle for the inferior vena cava because usually the liver is also harvested. So they also need a bit of the inferior vena cava. So there's always a tussle between us and the liver surgeons as to how much we have to cut, how much they have to take. There have been times when we had reached the donor site. We were waiting there. This was a 4-year-old kid. So we were seeing for a 3-year-old kid. So it's difficult to get pediatric donors, a brain dead donor, size matching for a young kid. So this kid was very sick, quite sick, and was waiting for quite some time. So we have to make sure that it is mutual. We make a mutual understanding in the beginning that I'm going to cut here, just above the level of the diaphragm is mine, below the level of the diaphragm is yours. So sometimes in a kind of frenzy, at that moment we tend to cut a little more, and they kind of get a little angry at us. Initially we went and assessed, the heart was very good and it was kind of perfect match for this kid. This was a 3-year-old kid, 4-year-old. We thought, okay, jackpot, this kid is going to do well. This is very sick also. So that is where we do. So all the great vessels are chopped off, and the last to be cut out is the left atrium. So that is the posterior here, if you can see this area. So this roof part of it is left behind, and just at the level of pulmonary veins, we chop all the pulmonary veins and take out the heart. That's how we do it. By the time the process got over and the donor was ready to be shifted, the heart had completely deteriorated. So the function was too bad that it was not fit for harvesting. So this kid could not get that heart, and this kid didn't get any other matching heart.
Australia is a country with pretty good health care and a good many physicians and nurses. As such, physician assistants have yet to find their place.
I was a paramedic, started in 1987 after a couple of years post-uni. Loved the job. Started in Sydney. I ended up moving country. To go country, I needed to move to Queensland and did nursing. And towards the end of my nursing degree, I heard a talk on PAs and went, oh, holy hell, that's what I want to be.
So can you tell me about the Australian healthcare system and the impetus for starting this program here? I mean, why do this here? I mean, who's pushing you? I mean,
yeah, sure. At the time they started fooling with the idea back in the 90s, 1990s, there was a shortage of doctors, and there was a very gross misdistribution of health workforce in those underserved areas. So that was the original intention of the people that were really moving towards pushing this. Over the course of time, things changed somewhat, and for a number of different very complicated reasons, we went from a doctor shortage to now an oversupply, especially of medical students and young junior doctors, as they're called here.
Had trouble finding placements. Can you talk about from that when you first started to how you got here?
I went back and was a paramedic for 5 years, waiting, hoping, and eventually one of the JCU students did a placement through here in ED, and once again a doctor who had great foresight went, oh hell, I can see how this would work, and he got some funding for a trial, and there was started with 3 of us. I was lucky enough to be one of those 3, and we're here.
As far as the sort of social side of healthcare goes, it's a very, very conservative system. It's still very doctor-centric. Concepts like team-based healthcare, delegation, task substitution are all very, very new concepts here. And some of the more conservative organizations, like the Australian Medical Association, like most of the nurses' organizations, unions, are opposed to us because they see us as a threat one way or another.
So how much are you limited compared to like an American PA?
Yeah. Where 90% of our stuff is just taking bloods, ordering, taking bloods, imaging, just that initial stuff. Yeah, people don't know what PAs can do, and until they do, and slowly, Mitch and I are just adding bits, and if you look at the other PAs throughout Australia, that are just, and there's very few doctors that once they've worked with you and figured out what you can do, can't see potential. You know, the light bulb. Oh, you could do this, you could do that. Perfect.
The other problem is that we're only recognized in 1 state out of 6 states and 2 territories here in Australia to practice in the public healthcare system, and that's Queensland right here. You can see behind us the hospital, the Townsville Hospital, and that is the first place to actually hire PAs here in Queensland. And to give you an idea of the tyranny of distance here in Australia, that is the tertiary medical center between here and Brisbane, which is 900 miles south, and Port Moresby, Papua New Guinea. In fact, we're closer to Port Moresby. So in between are base hospitals, quite a few steps down, and rural hospitals, but that's it. That's the tertiary care center until you get down to our capital, Brisbane. So there's great need in rural and remote areas in Queensland for all the healthcare workforce that you can get a hold of, and that's hopefully where we're going to make our mark.
Laos and the neighboring countries of Thailand, Cambodia, and Vietnam are where the first U.S. physician assistants got their experience. During the Vietnam War, the U.S. supported the Royal Lao government. U.S. operatives engaged in special operations and psychological warfare, providing everything from medical care to weapons. At the same time, U.S. planes dropped millions of tons of bombs on communist positions. Many bombs did not detonate, prompting governments and NGOs to assist Laos today. One U.S. NGO is providing medical training to mid-level healthcare workers.
Because we know that there is a lot of unexploded ordnance that remains in Laos that was dropped by the U.S. military. We know that that ordnance does, there are explosions and people are hurt. There are a lot of disabilities caused by those explosions. So it's the idea of working and training people to be first responders to manage patients after accidents. And so this is the program that we are rolling out at the colleges of health science and then also at the district hospital level. It's important to note that we take our direction from the Ministry of Health, and so we ask them what types of training they would like. So from the very beginning, we have done ultrasound training, and we donate ultrasounds, small ultrasounds that can be used in more remote areas.
A medical assistant or PA, right? So in a Lao context, who worked in a health dispensary, needs to be able to do pharmacy, immunization injection, prenatal care, all of this, because that's basically, there may be 3 to 5 of them in one particular, one health dispensary.
So you're almost getting these people up to PA level just by continued training.
Yes, we are now negotiating a new MOU, and we'll be negotiating to work with individuals, healthcare providers from rural hospitals who are mid-levels, who have a lot of experience in the field and then need to improve their skills.
Mm-hmm. So how far does the person have to go to get medical care?
City area easier, right? So, but in rural area, you can, the road is not accessible by car, so that people have to walk. So if you have a medical emergency, for example, like obstetric emergency, they have to carry village. People have to carry them.
Did you have patients here?
Well, I just told my my family that when I come back from Samanakhet Friday that evening, I'm gonna do a presentation on how to prevent, and then because really unfortunately a few family members already have diabetes. You know, when I was here for public health, that wasn't a big deal at all. But with now that people are
more westernized,
you see all the food coming in, and then the knowledge about what's good for health, they kind of lag behind. Same thing, when what I saw in Guam, So there is really big problem here. So I'm gonna do that. So I'm telling them to tell friends, to tell anybody to come. So I'm gonna do that kind of small talk to them about that. And that is something too, like I really think in the future, to come back more and stay longer, we'll be focused on really educating people on this part too. This
That's
is more
why
like
the
a big
PA model works well here, though, because it's more the primary care, work on cardiovascular disease, including diabetes and hypertension.
Right. So, yep, absolutely.
They're just like the rest of the world. They have problems.
Yep.
So, how did you do on the test?
I passed.
Are you officially a PA then?
No, there's still the Husky test.
What's this?
You need to sit with the two emergency medicine specialists. They need to ask you a question front. They're like introducing a case to you, and you need to say what test you're gonna do, what do you expect, how are you gonna manage this thing.
Okay, so it's kind of more like an oral test.
Yeah.
The dynamism inside the theater is what attracted me to it. So every day is different, every case is different, every patient is different. You have to act as per the case. So that was very, very challenging. And I love challenges. So that's how I got into it.
So that kind of, the challenge and the adrenaline. And
Absolutely, yeah. I didn't want to use the word adrenaline, but yeah, it's that adrenaline that keeps you going.
And we're starting to, like I do ultrasound guided cannulas, which not everyone does. So the patient we saw that I said hi to out the front there, she's a difficult patient with difficult veins, so she wants me to put a cannula in when I'm here. So.
And I don't think anyone would like to be a survivor. But you would like to be a survivor when you are infected. Yeah, so you see that once you are infected, you want to be a survivor, but I never want to be a survivor. So I always told people that, for people who sometimes look down on Ebola survivors, I always told people this. And I think we can all live together, and we can do better, in one accord.
Next moment I was standing there in the big football stadium where the mayor of my town came, and I was really shocked. So they don't knight you with a sword here. It's just they put on this cross and that's it. Yeah. And it's family. Yeah.
Thank you so much.
You're welcome. You're welcome.
Always enough. Well, you go first. Guest. The guest goes first.
See how thick the yolk is with the white. So it's really got to be beat. A little thick on the meat and the cheese.
Is this healthy?
No. Nobody knows. There you go, duck ache from work goes back to work. the energy to take care of my patients. Any leftover cholesterol medication I use.
But yeah, coming home to Lao food.
To Lao food, yes, that's the biggest thing you miss, yeah. It's good food. Yeah.
Yeah, good food.
I always hang out with Campo because she always knows where the good food is.
The street food, right?
Yeah, we eat street food together.
Yeah.
I think you showed me your favorite noodle place one
Right,
time
one
in
time.
Prabang.
Yeah.
Now I can't stop going there. It's my favorite place.
Yes, my favorite place to go, yeah.
We need healthcare professionals, you know, we need to help the rural areas. That's where the most help is needed, you know. So I just hope it just grows as it is now currently, which I feel with Quality Health. Yeah, it's growing. Yeah. Thank you. I hope I did okay.
But so I'm really excited so I'm a first year student and I'm really excited to start next year going to placements.